This is the Equity Charter podcast, where we talk about why we care about equity in the digital health sector and why we think you should too. Welcome to this week's episode of the Equity Charter podcast. My name is Aisha Rahim and I'm a psychiatrist and Chief Clinical Information Officer working in the NHS. Along with my colleagues Hassan Chowdhury and Victoria Betton, we developed 10 principles for embedding equity within the digital health sector. For our final episode of the series, we're talking today about the Equity Charter Community of Practice. Here to talk us through this are our two facilitators, Emily Burch, Chief Nursing Information Officer, and Gurnak Singh Dosanjh, GP and Chief Clinical Information Officer. Welcome to the show, Emily and Gurnak.
Hi, really, thank you for having us.
Yeah, hi, thank you for having us. It's lovely to be here.
Great stuff. Okay, so we'll start off with a little bit about yourselves. So, Emily, do you want to say a little bit about who you are and what you do?
Thank you. So I'm Emily. I'm a Chief Nursing Information Officer at the North London NHS Foundation Trust. So that's a large mental health trust in now the newly formed West and North London ICB area. I'm a general nurse by background, but I have always had an interest in mental health and substance misuse. So I've sort of weaved myself in and out of mental health areas of work for nursing and then found myself in a digital role. I've got a background as a Digital Topple Fellow and a Florence Nightingale Digital Scholar, and I'm currently doing a Master's in Medical Anthropology and Mental Health.
Fantastic. Thank you very much for that intro, Emily. And same question to you, Gurnak. Tell us a bit about yourself.
Thank you, Aisha. Yeah, it's lovely to be here. So my name's Gurnak Dosanjh. I'm a GP from Leicester. And I've also got kind of a couple of different roles that I wear. So I'm a clinical lead for our ICB, which is Leicestershire Rutland, where I specifically cover cancer and frailty. And as part of that role, I'm also the Deputy Chief Clinical Information Officer. So from my perspective, I think, I've kind of got a background in digital transformation. I did a diploma with Imperial College, which was a digital health leadership diploma. And then again, found myself kind of in digital facing roles. It's been a huge part of my journey in terms of understanding some of the challenges that individuals face, not just within digital spheres, but also non-digital spheres. And that's one of the things that has really, really excited me about today's podcast, because it's about people and how we bring those people together and how we will hopefully discuss some of that in terms of what that means for the Equity Charter and the community of practice as well.
Absolutely. And of course, you are our two fantastic facilitators for the community of practice. But I'd like to take it a step back, if I may, to begin with, and ask you both about what is it that sparked your interest in equity and more specifically digital health equity. So, Gurnak, I don't know if you want to go first and say a little bit about that.
Yeah, absolutely. I think from my perspective, health inequity didn't necessarily start from digital. So my background, I'm Punjabi. I'm a third generation / second generation Punjabi. My dad wasn't born in the UK, and so kind of faced lots of challenges himself when he came into the country, and he was navigating healthcare systems and many other systems for that matter of fact. So I kind of saw it growing up and never really kind of understood it or put a label on it. But when I entered medicine, one of my kind of key areas was that I never wanted to leave anyone behind. And I know that sounds really, really corny, but it was really, really important for me. I saw lots of family members who would often complain about some of the challenges around healthcare, or how sometimes they might have felt fobbed off, or how perhaps sometimes they would really struggle to get their voices heard. And these are just in passing conversations. So I kind of felt like being a clinician, being in the medical world, I had almost like a responsibility to try and do something about it. Fast forward many, many years, and as digital transformation really started to flourish, I've kind of found myself almost accidentally in a digital transformation role, but really started to see some real big gaps. Really simple stuff to start off with, things like, how would someone like my dad remember a really complex email with 10 letters, 2 digits, a couple of symbols, all the way through to actually he doesn't even have an email address. So how can he do something which requires an email address, or requires him creating a password? So a lot of these thoughts really started to come into my mind about, are we maybe leaving people behind? We're starting to transform things in such wonderful ways, in ways that the healthcare system absolutely needs. But at the same time, are we going to leave some people behind, either due to language challenges, due to challenges with digital confidence, challenges with lack of devices or lack of internet? Services that don't really reflect people's different circumstances. And so for me, I think I kind of really noticed that there was a problem here, or certainly a problem that could very well emerge. And so I really wanted to make sure that, much like how it was just around health inequity, that digital health inequity doesn't become the next thing that we're talking about in 10 years' time that has left a whole bunch of individuals behind. And a really interesting transformation always springs to mind around dementia and patients with dementia. Locally in Leicester, we had some dementia services that perhaps were not being best utilised. We've got a very ethnic population, and we were seeing that a lot of our population from perhaps the white background were really tapping into some of the services that were available, and those from people from South Asia were not really using these services as much. And in particular, there's one service which was around the use of music and dance, which, for those that aren't aware, music and dance can really, really help those individuals who have got memory loss. It takes you back to a specific place, and it can just help people in ways that are, not necessarily, they don't give you a number or they don't give you a specific rating, but they just help people go back to a special space. And there's lots of positive evidence around the impact of music and dance with memory loss. And so people started talking, and it came to the digital teams, and we thought, great, what a great thing. Let's create some digital avatars. Let's make some translatable things which we can use in lots of different languages, and we can make using AI, we can make them look a particular way, and we can dress them in a particular way, and that's going to crack it. We're going to get everyone who doesn't speak English using these services. And then someone kind of said, well, actually, why don't we just find out what the problem is? Let's find out why the Asian communities might not be accessing this. And so, of course, you've got people in the room who are carers and kind of family members, and they said, we don't really listen to Elvis Presley. We don't really listen to ABBA. It doesn't really resonate with my mum. She likes Bollywood music. And, that was when the penny really dropped, right? Okay, let's just ask people. Let's just actually ask people, what is the issue here? And then someone in the room had a great idea. Someone said, oh, you know what, we've got my son or daughter, I forget now, but my child goes to a class and they teach her Bollywood dance. So why don't we ask this person if they could teach some Bollywood dancing to people with dementia? And so you've got music and dance, things that really relate to people from the South Asian community. And so that's what was created, right? So it was a wonderful moment where there was about 20 or so women Asian women who all have dementia, and they were doing a dance performance to Bollywood music. And it was fantastically wonderful to see at this day, celebrating all things around people with dementia.
It's so interesting to me because, of course, we all these days work in communities that are very diverse, whatever part of the NHS that we inhabit. But there's something about that personal experience that really drives that message home in a different way, doesn't it? And so, Emily, what about you? What's your story for your journey into this world?
So I've been thinking about this and trying to pinpoint where that might have started. And I think I've got my personal experiences. So in my current organisation, I co-chair the Disability Network, but it's only been in the last couple of years that I've even felt able to be open and candid around my health and my disabilities. I have ADHD and I have 2 neurological conditions, something called idiopathic intracranial hypertension and chronic complex migraines. So I get around 24 days of migraine a month. My injections that I get now reduce it down to maybe 15 days a month, but it took 2 years of fighting the NHS system to be seen and to get help. But then I thought, so there's that side of it, like, how do you advocate? So even though I work in a senior position in the NHS, I never feel able to advocate for myself within our own system. And I found that incredibly challenging. But then I think it goes back even further. I can remember times growing up as a child, I would always notice those that were on the outside and felt incredibly that didn't seem right. So my parents said, you were always the one that, you know, if someone was stood alone on the outside of a room, you would go and bring them into whatever you were doing. So I think I've always felt that need to connect with those who perhaps aren't seen and to make sure that they could feel seen. And I remember my dad sort of advising me as I was growing up to sort of say, if you see injustice, it is not okay to sit by and be silent, because that makes you complicit in what's happening. And then there was a really pivotal moment during COVID for me, that because at that point I thought I was a fairly good ally, you know, always trying to make sure I noticed those who were silent and to bring them into a room. But during COVID, we had done a piece of work around learning disabilities and vaccinations. So before sort of it became a national picture, I had worked with our partners at the Royal Free to convince them to do our staff vaccinations so that we could open a specialist learning disability and serious mental illness vaccination hub for patients in North Central London, because I became really aware from our vaccinators that these patients just could not manage in a large vaccination site, but there wasn't any facilities for them. So we did this great piece of work and we were interviewed by the BBC, and we had our vaccinators there, we had patients. It was what I thought a really lovely day. And then one of my vaccinators, and it was so brave of her, and so she articulated herself so well, but she told me how angry she was with me and with the day. And I didn't understand. So I sat and listened, and she explained that as the only Black woman in the vaccination team, the interviewer hadn't even bothered to try and pronounce her name or say her name. Everyone else had been interviewed, and she was just videoed doing the practical side of the vaccination. And she told me how hurt she felt that I didn't see this and I didn't do anything about it. And I sat there and I thought, there could have been all these excuses. That's the first time I've ever done any kind of interviews like that. Or, you know, there were plenty of excuses that I could have gone to. But I sat there and I thought, no, you're right. That is your experience. I didn't see it. And I vowed sort of there and then that I would always see it and I would always find a way to call it out. Because I still remember her face. I still remember, and the sadness in that wasn't her only experience of that kind of dismissal from people around her, that how unseen she felt. And I did not want that to happen again to anybody else. And then, of course, you know, in digital, and again, COVID, a great example of how these things come to light. No one was curious. So they were making these big decisions about operational things and digital tools and how we were going to deliver care. No one asked the question around, what about those without access? What about those that, you know, how are we supporting our vulnerable communities? It just kind of disappeared. People didn't ask the question. And I felt that at least a role I can play is at least always ask the question and make sure that that's front and center, so that people can't dismiss it or say we didn't think about it. I will make sure that I'm in the room and I ask the difficult question. We may not have an answer, but at least it's there so we can do something about it.
I think those are some really striking and powerful examples that you've given there. And there is something, isn't there, about being attuned to a problem. And once you start actively and proactively looking out for it, then you start to notice more and more. So that's a really powerful sort of description of your journey to this point. And the other thing as you're talking, Emily, is I was just... it just occurred to me that even for us as professionals working in the health system, how difficult this can be to navigate and to advocate for ourselves in that position. So then extrapolate that to people that aren't familiar with the NHS, aren't familiar with healthcare provision, who are already disadvantaged by whatever protected characteristic or other demographic or other factor maybe that already disadvantages them in terms of health outcomes, how much more difficult it is with that unfamiliarity. It's almost like that double whammy, isn't it?
Oh yeah, the worse my experience is, the harder I want to fight for everybody else. I sit there and think, I know how this system works. I have friends who can help me get through this, and I have a family to support me, and I still can't access care that I always need, that I might need.
So I can see why you're both really passionate about this, and that's why it's so great that you are both leading our community of practice. So Emily, do you want to actually tell us a little bit about this community then and how it works?
Oh, I love it. So at the moment, we've done some virtual sessions. The idea grew because communities of practice are often places where, outside of sort of structural organizational norms, you can come together, and it doesn't matter your hierarchy, it doesn't matter your position. You can really work through complex, difficult challenges, learn from each other, and build a way forward. So when we thought about the Equity Charter, I think we were both sort of really struck by how nuanced and difficult some of the conversations would be, that with everything that's changing in the NHS and the political landscape, that having open and honest conversations about equity can feel sometimes challenging, can feel unsafe in certain spaces. And when that happens, that's when inequity can grow, because people feel unable to express their learning, their understanding, or their opinion. So we wanted to create somewhere that we could come together based on the Equity Charter's principles, create something that was psychologically safe, but the ground rules allow you to have that discourse, allow you to have that discussion, disagree with one another in a careful way, and learn. And more than that, wasn't it, Gurnak? We then wanted to take that learning and challenge ourselves to make sure we weren't just creating an echo chamber of talking, that we were then delivering practical ways or actions that could turn this into something more powerful to keep that movement and momentum building.
And Gurnak, what's been your experience of the meetings that have been held to date?
So many wonderful points that Emily's just shared there. I'm a bit of a movie geek, so I always try to think of it in terms of different movies and different kind of things that other people might have experienced. And for me, I think the key thing here is around Emily's point of that person who was left at the edge of the playground, or the person that wasn't quite bought in or didn't maybe feel strong enough to have that voice to maybe speak up a bit loudly about what their perspective was. And when we really come down to equity, I think Emily's phrased it in such a nice way. It's about understanding everyone's journey. And if you don't have those voices in the room, you're never going to fully understand what another person's journey looks like. And I think that's what really matters to me. And this is the thing that for me, why the community of practice is so important, because it's not just about the healthcare clinicians or the people that work in healthcare. When we think about digital health, it's so uniquely positioned because it covers the clinicians, it covers the operational teams, it covers the management teams, it covers patients, it covers the suppliers that are bringing in the technologies, it comes the people that are looking at the data behind that, the academics, the innovators, the entrepreneurs. The list goes on and on and on. And there are so many different pieces of puzzles that, if we're going to really shift the dial, if we're really going to make a difference, and we're really not going to, we're going to try our hardest to not leave people behind, it's about bringing all of those people together and helping them perhaps understand different perspectives, different angles, what matters to individuals. I kind of often think about as, hopefully getting to a point a little bit like the Avengers, right? Everyone has got their own superpowers and they've got their own particular strengths. Some people are really good at like magic spells, but might not be very strong. And some people might be really, really strong, but not very good at magic spells. And I think that the key thing is about bringing all of those different viewpoints together. And I think for me, that's the starting point of the community of practice. I know there's lots of fantastic research out there, but for me, it's really, really simple. It's just about bringing people together and sharing those experiences. And even off the back of that, people were starting to think differently. People were starting to think, okay, I hadn't considered that, or I hadn't experienced that, or see things from a different perspective. And, a lot of these conversations were happening after the meeting. They were happening, kind of not necessarily in the meeting, but it starts to sow a seed.
And that's a really good point, isn't it, in terms of the inclusivity about the community of practice? Because I think it's often very tempting to see this as an NHS provision of care issue when we're talking about digital access, for example. But of course, the issues of inequity in digital health, they start way upstream from that. So it is about how our products are designed. It is about how the research is conducted and who the research is conducted on. So the community of practice is, of course, for everybody involved in digital health, whether you're public sector, commercial sector, arm's length bodies. So it's great to see that reflected in the people that are attending. But the bit I wanted to pick up on particularly, and maybe Emily, you might have some thoughts on this, is around the point you made, Gurnak, about how we move from this position of it being a talking shop and it being an echo chamber, and how we actually get to the ways in which communities of practice work and actually some of the research behind what they bring to a movement. Yeah, I'm interested in hearing more about
now
that.
You're talking my language. Now the anthropologist in me will come out, and it feels weird calling myself that, but I'm going to embrace it. So there is anthropological theory behind communities of practice. It's called communitas by Victor Turner, which I think really fits into, helps us understand where the community practice starts, but where it can go. So when we think about CAS, I can't say it very well, so my apologies to everybody who studies anthropology. But the link is about how you form these groups. So Victor Turner looked at how groups create support structures and stories, rituals, belonging, expectations and social norms. So through that community, you create a shared language, shared values, accountability, shared imagination. And if you think about it, people rarely change because they're told to. So that change is often created through these social and moral communities. They change because the relationships and stories and shared experiences. So a community of practice, this theory that underpins it, talks about how those groups create new ways of thinking and can then push boundaries. And it's interesting because when you start to look at it, it really then supports another area. So there is I want to say Wegener looks at the practical sides of community. So you've got Victor Turner that looks at how you start creating that experience. So he really also focuses in on something that Gurnak has said around no titles. This is about bringing a community together through relationships and meaning making. And that's why it's so important. It creates the atmosphere for change. But then Wegener then started to look at the structural ways in which that can be changed. How you move community practice from somewhere where new thinking begins into something that's got structure that can actually then deliver on what it's talking about. So I think the two together are really important to understand why communities of practice work. And there was this quote that I came across that I think really sums up the theory behind it. So it's by Victor Turner, and the reason I like him so much at the moment is because he's underpinning an awful lot of my theory in my master's dissertation. But he talks about communities is not the pleasurable and effortless comradeship that comes and arises between friends, co-workers or professional colleagues at any day. What it is a transformative experience that goes to the root of each person's being and finds in that root something profoundly communal and shared. And I think the equity charter work, if we listen, having listened to each other and why we're brought into this, why you started it, Aisha, with Hassan and Victoria, there's something in that root, something there that we felt required transformation, and bringing that community together, building that meaning making, those relationships, then gives you the ability to start then pushing back on the structures around you. Because what a community of practice can't do, it can't replace organisational leadership, and it can't replace governance in organisations. It doesn't replace workforce reform or structural equity on its own. it can't dismantle it by itself, but it can create the relationships, the language, confidence, and collective agency needed for that work to happen.
Do you know, that's so profound and so relatable, because when I think back, we covered some of this ground in the very first episode of this podcast, episode 0, if you like, when we talked about the founding of the Equity Charter. And I still look back and think how strange it was that this was all started by 3 people that felt quite angry and strongly in a very specific direction. And we had that relationship that was pre-existing that allowed us to build something which has then grown and grown over the last 2 years. And it feels like that's a really key function of the community of practice, is to give people the confidence to be change makers in their sphere of influence, because it can feel like quite lonely work at time when you're trying in your own organisation often to make these changes, to nudge people and influence people, but having the backing of a group of colleagues that might be outside of your organisation but that feel very similarly, to actually be a little adventurous and exploratory and start to push some of those boundaries. But yeah, doing it in isolation is really difficult sometimes, isn't it?
Yeah, I mean, it's so hard. And I've seen this in other sort of peer support groups. So I think that there is something around building a place where communities and people can begin to put aside perhaps where they see themselves in an organisation or where they see themselves in a peer group or support group, and building trust with one another and finding ways to challenge each other and challenge existing structures that brought them together in the first place. I think that's why I love the community practice. When you bring people together, the learning that is there, the acknowledgement that there is inequity in our current structures, that is embedded, and it takes a lot to dismantle that, but that you've got people there willing to share their thoughts, their ideas, even if it might be a little bit controversial, or maybe it might sit outside what some of us had thought before, but being able to bring it to the table and have thoughtful, meaningful discussion around it is amazing. And how you move forward is then taking that learning, making sure that participation grows, that you're sharing that knowledge and you develop more in that practice, practical ways of supporting those in the community to feel the ability to continue to question that inequity and that structural inequity wherever they go. Because if you've got people around you that are supporting you and you're learning and you're putting your best foot forward, then being able to do that when you go out into your areas where you have influence makes it so much more powerful, because you have that community behind you to support.
It's also a place to highlight work that people are already doing that's successful, because actually, as daunting as this may feel, there are really good pockets of excellent practice where people have been able to make changes in their environment that's led to some real improvement in nudging that needle towards equity. So sharing some of those successes, but also some of the challenges, because that's what you often learn most from, is like, well, I tried to do this and it didn't quite go to plan, and this is why. Spreading that learning from organisation to organisation through that psychological safe space of a community practice, I think, is super powerful as well, isn't it?
Yeah, I think I'd just like to kind of follow up on that, because I think we've talked about the psychological space a couple of times, and I've kind of been part of other communities of practice, some that are called communities of practice, some that are just off the back of a WhatsApp group of a few people with a similar thought process getting together. But the principles are really the same. But I think the challenges with health equity, and certainly within digital health equity, these can be really, really sensitive conversations, really, really things that are touching on, we might have differing views on things. And one of the things that I often like to share is that, sometimes this isn't about being the experts in the room. It's just about having the strength and the humbleness to be able to see it from a different perspective. And, if there's one thing that I can always encourage people to do, it's to come to a community of practice, especially this community of practice, and come with just an open mind, just come with a willingness to learn, because we've got people from, really different ends, people that are absolute experts in EDI, and others that are just really, really inquisitive and learning. And the key thing is that every single one of those, I alluded to the Avengers earlier, every single one of those people matters in that team. And it reminds me of a story that I shared actually right at the beginning of when we started the community of practice. And for those that have got perhaps toddlers or who have had toddlers recently or in the last kind of 10, 15 years or so, there's a story called The Monkey Puzzle, which I absolutely love. It's one of my favourite stories. And it's about this little monkey who, unfortunately, he loses his mummy in the jungle. And he's looking for his mummy, and a butterfly comes along and kind of says, don't cry, what's wrong? And this little monkey says, I've lost my mummy. And so the butterfly goes, don't worry, we'll find her, tell me what she looks like. And the monkey just kind of replies back and says, she's really big and she's tall. And so the butterfly goes, oh, that's fantastic, I know exactly where she is. And she takes her to an elephant. She takes the monkey to an elephant. And this little monkey says, well, nothing like me. And the story goes on, and the monkey then says, she lives in a tree. And so the butterfly takes her to a snake and says, well, can't you see this snake looks nothing like me? And then right at the end of the story, the butterfly, the monkey gets very, very annoyed at this point and says, why can't you see none of these animals look anything like me? And the butterfly says, well, I didn't know. Because when you look at my babies, they look nothing like me. And her babies, of course, were not born as butterflies. They look completely different. So it's all about perception, and it's all about recognizing everyone else's differences in their journey and what they see. And so I think if there's one thing that we've really, really focused on, it's around trying to create that safe psychological space to not just share your thoughts, but also to challenge and to also push back. And within that, we as a community also have to be receiving of that. We have to be willing to understand what our own blind spots are. Because as we continue to progress, there will be new blind spots that might emerge, or blind spots that we weren't aware of. There may still be that individual, like Emily alluded to, who may not have had the opportunity to take part in that interview for whatever reason it is. So we have to be open to that, and we have to continue to grow together. And I think that's really important as well, because this community of practice isn't around the people that are leading it. It's not, about myself or Emily. It's about the village. It's about everyone who's involved. And that's, one of our first aims when we got together, Emily and I, we kind of actually said, we want this to be about the community, right? The community need to own this. The community need to shape this. And the community needs to tell us where it wants to go. And then it's a genuine community, right? Then it is that shared collective. It's that shared understanding.
I'm definitely going to keep that fantastic monkey puzzle story in my back pocket to whip out again. I really like that. And, a really important message there as well about you don't have to have the answers when you come to the community of practice, but just having an open mind to learn and be prepared, I guess, to then act and translate into action. I think it sounds like it's the key thing. And so actually on that point, how do we ensure that the community of practice is more than just a forum where people can talk? How do we then transition that into individual action?
I think at the moment, our last session was really powerful because we started by having this kind of debate around influence and impact off of looking at a list that was published and sort of trying to understand why that list perhaps
this was a list of influential people.
People in digital, yeah. And some, you can't deny amazing work from amazing people, but also, there was questions around the diversity within the list and who gets chosen. It reminds me of that playground. Whose stories are there to be shared? Who is thought of in the room? And we kind of opened it up to this discussion, and we had this really great discussion around impact and influence, and thinking about actually a practical way of moving some of this work forward and learning and the community practice is how do we showcase impactful and influential people and work within the community that is addressing the principles of the Equity Charter. It's important that we keep those principles in mind. That is what's underpinned everything that we're doing. but how do we create a platform to lift that work up? So not only are you then making sure those stories are heard, that unseen work is seen, but also then how do you then support others to see it too and take that learning and make it spread? So you do two things by doing this sort of action in the community practice. We are helping to identify and understand what impact and influence means in this sphere, how we then can support those people working in that area to be lifted up and given an opportunity to showcase that work. But then also then, how do we then take that showcase and see that it's scalable and spreadable throughout other organisations?
Yeah, I think that's really important, isn't it? And I know that we've talked in the Equity Charter quite a lot about compiling some positive case stories and case studies for organisations, teams that have been on a journey of sorts to make these tangible changes to how they do business in terms of, again, moving that dial further towards equity. And it fits in quite nicely with some of our plans as an organisation, as the Equity Charter, to develop a diagnostic service for organisations. So if you are in an organisation and you are not necessarily, I suppose you haven't cracked it because nobody's cracked this. But if you're curious and you want to see how your organisation stacks up, you can invite us in to your organisation to benchmark where you are at the moment against the 10 principles. And we can help you develop a route or a roadmap to improvement for your chosen principles that you want to focus on. And so we think that by doing more of those diagnostic sessions for organisations, we'll start to build up this compendium of case studies that will then help propagate this fantastic practice. So if you are an organisation that wants to invite the Equity Charter in, please do get in touch with us. But I think the community practice is that other way, isn't it, of sharing that really good learning.
And so I think if there's something that I'm really hopeful that our community practice can do, is just instill that kind of genuine curiosity to ask those questions when they go back to their own organisations. And so they can then go back and say, well, hang on a minute, let's try it in a different way, or let's ask this question and let's see if we get the answers. Because often the hard answers are already in the room. We just don't have the right people in the room asking those questions.
I think that's a fantastic call to action for people to join this community of practice that we've been talking about. So the final thing for me to do is to ask you, how can somebody join this community of practice if they are interested in what they've heard today?
So I think there are a number of ways. You can reach out to myself and Gurnak, and we will add you to our list. We've got, I believe we have on LinkedIn information there as to sort of who to contact. I even want to say we might have a form or a sign-up sheet. We do, yes, which is which, you know, put your name in and we'll send you out all the details. We try and meet around once a quarter, and we are looking at doing an in-person event towards the end of the year. But the work doesn't just happen within that sort of virtual community practice space that we're creating. It is everything in between. That the community of practice sessions is the seed. All the growing happens outside of that community of practice. And Gurnak and I are here and available to sort of support, guide, help, bring you in. You know, we're sort of open books, and we want to learn from everyone as well. So we want to learn.
Yeah, and just to add to that, I think I would say that the community practice is open to absolutely anyone. It really doesn't matter what your background is, what your experience is. You don't need to be an expert in equity. You don't need to be an expert in digital health either, to be completely transparent, because the way that we're moving now, digital is becoming a core part of all of our lives within healthcare. And, you know, one of the nicest things is when we do sit in those rooms, we've got people right across the range, from people who are clinical to people who are entrepreneurs and innovators and everyone in between. So, yeah, I mean, you know, if you've got any questions around it, or you're just not sure, as Emily mentioned, please feel free to reach out to either one of us, and we'd be more than happy to just explain what it might look like for either yourself or other people in your organisation. And, yeah, we're happy to help where we can.
That's fantastic. So we will put both of your LinkedIn profiles in the show notes to this episode. We'll also make sure that we have our email address in the show notes, and it is hello@equitycharter.digital. So you can reach our team there and join the community of practice through that means. So all that remains for me to do now today is to thank you both for your time today. Thank you for joining us. Thank you for tuning in to this week's episode of the Equity Charter podcast. Don't forget to rate, review and subscribe to the series. And if you'd like to know more, go to our website at www.equitycharter.digital. You can follow our page on LinkedIn, join our community of practice, and you can also contact us at hello@equitycharter.digital.